maturity have not occurred yet. तो यहाँ पे एक plate होगी. क्या plate होगी? Very good. It is known as the growth plate, also known as the
growth plate.
physis. Shabash. So due to this growth plate of physis, there is increase in the length of the bone, or there is longitudinal growth of the bone which occurs. Okay, and then this physis, इसमें क्या हो जाएगा? क्या deposit होगा? Very good. बोलो. So this physis is actually a cartilaginous plate which will help in the longitudinal growth of the bone or increase in the size of a long bone. But after certain age, what will happen? There is deposition of calcium in this physial plate, and then there would be mineralization of this physial plate. या फिर उसको क्या बोल सकते हो? Ossification हो जाता है, वो कड़क हो जाती है, and then now the growth of the long bones will not occur further. And that time we say, okay, the person has attained his skeletal maturity. Usually the time is 18 to 25 years of age. No issues with this? Okay, if I talk about the bones, they undergo their ossification or mineralization by two types. One is called as enchondral ossification. Other is called as intramembranous ossification. What do I mean by this? Ossification क्या होता है बच्चों? Ossification is deposition of calcium or calcium hydroxyapatite crystals in the bone and formation of a bone. That is what is called as ossification. ठीक है? The ossification occurs with the help of a primary center. Primary center is the one which is present before birth in the intrauterine life, and secondary center is the one which appears after birth. There will only be one primary center, and more than one secondary centers can be there in any long bone. No issues with this. There is only one long bone in the body जिसके दो primary centers होते हैं, which has two primary center, and that is clavicle. Shabash. And clavicle is the only long bone in the body which has only one secondary center. ठीक है? तो बाकियों में उल्टा होता है. बाकियों में primary center कितना होगा? एक, और secondary एक से ज्यादा. But clavicle is completely opposite. Clavicle में दो primary centers होते हैं और बस एक secondary center होता है. That is always an exception. It is also the most common fractured bone of the body. It is the subcutaneous bone. Subcutaneous मतलब it can be palpated throughout its course. ठीक है? कहीं भी ऐसा नहीं हो सकता कि तुम palpate नहीं कर सकते clavicle को. ठीक है? It is the only long bone which is horizontally placed. बाकी सब long bones in the body are vertically or longitudinally placed. No issues with this. So that is about your clavicle. What is the most common site of fracture clavicle? That was a question in your examination. Very good. It is the junction of lateral 1/3 and the medial 2/3 of the clavicle. Now, if I talk about enchondral ossification, enchondral matlab inside the cartilages when the bones will undergo ossification. So enchondral ossification is shown by all which type of bones? अरे भाइयों, enchondral ossification is shown by long bones or flat bones in the body? Enchondral ossification is shown by long bones or flat bones in the body? तो इसमें इतना टाइम लगने की क्या जरूरत थी? Enchondral ossification is shown by all the long bones inside the body except one. Exception हमेशा कौन सा होगा? Clavicle. So though clavicle is a long bone, it ossifies within the membrane. So intramembranous ossification is shown by clavicle and all the other flat bones. What do I mean by flat bones? Facial bones, skull bones, these are flat bones. ठीक है? Vertebra or your sternum, all of these are flat bones. ठीक है? They ossify within the membrane. That's the basic start of anatomy. यहाँ से anatomy start होनी चाहिए. Now, if I talk about the epiphysis, there can be various or different types of epiphysis in a patient which are created, okay, which are created due to some reasons. So, सबसे पहला जो होता है, let's see the types of epiphysis. The first one that you can see is called as the pressure epiphysis. Pressure क्यों बोला जाता है? Because it will convey the pressure of the appendicular skeleton to the axial skeleton. What do I mean by this? समझ लो. That means तुम्हारे हाथों पैरों का जो pressure है, उनका जो weight है, that would be transmitted to your axial skeleton or your central part with the help of these type of epiphysis. And if they are transmitting the weight, therefore they will always be under pressure. Therefore, these are called as pressure epiphysis. So the ones which will transmit the weight to the central part of the body. First thing. Second, these pressure epiphyses always and always take part in joint formation. So they are always taking part in the joint formation. Yaad rakhna. Pressure epiphyses always take part in joint formation. What are the examples of pressure epiphyses? It is the head of the femur or the head of the humerus. The best examples of pressure epiphyses will be the head of the femur and the head of the humerus, because they transmit the pressure to the central part of the body, and they also take part in joint formation. Head of humerus takes part in shoulder joint, whereas head of femur takes part in hip joint formation. कोई दिक्कत नहीं है. So these are the pressure epiphyses. Then just below the pressure epiphyses, जहां जहां pressure epiphyses होते हैं ना, उसके आसपास there is high probability that we can see another types of epiphyses also. And what are these type of epiphyses called as? These are called as traction epiphyses. What do I mean by traction in a layman language? Traction का मतलब क्या होता है? Pull, right? So these epiphyses, they are not present, but क्या हो जाता है? There is some pull on the bone which creates these type of epiphyses. So there is some traction, there is some pull on the bone which will create these type of epiphyses. No issues with this, anybody? So due to the pull, the epiphyses which are created, okay, due to the pull, the epiphyses which are created, that are called as traction epiphyses. और ये pull किसका होगा? What is attached to the bone? Muscles. Very good. So when the muscle pulls, that causes a traction epiphysis. They're always present near to the pressure epiphysis. And second point, they do not take part in joint formation. They do not take part in any joint formation. Examples क्या हो गए? It can be the greater or the lesser trochanter of the femur. और मैं क्या बोल सकता हूँ? Greater and the lesser. Greater and the lesser tubercles of the humerus. So greater tubercle of humerus, lesser tubercle of humerus, greater trochanter of femur, lesser trochanter of femur. All of them are created due to a muscle pull. Therefore, all of these are examples of traction epiphysis. No issues with this. ये सबको बताया ना कि tubercles और trochanters पे a lot of muscle are inserted. No issues with this, anybody? So that is traction epiphysis. Then the third type that came in your examination, that is called as atavistic epiphysis. So atavistic epiphysis का मतलब क्या होता है? The one which ossifies, which starts ossifying as a separate bone. It starts ossifying, it starts forming as a separate bone, but then finally combines with the main bone. ठीक है? It starts forming as a separate bone पहले तो, but then it combines with the main bone. That is called as an atavistic epiphysis. Atavistic epiphysis के two important examples. One is the coracoid process of scapula. So this coracoid process of scapula starts ossifying as a separate bone, but then it combines with the scapula. And second one is called as the posterior tubercle of the talus bone. Talus bone is which type of a bone, anybody? Tarsal bone, na? Talus is a tarsal bone. So the posterior tubercle that is highlighted over here, the posterior tubercle which is there, it is also an example of atavistic epiphysis. And this posterior tubercle of talus is also known as os trigonum. And that has been your question. They did not even mention posterior tubercle of talus. They mentioned os trigonum is which type of epiphysis. So os trigonum is nothing else but the posterior tubercle of the talus, which is an example of atavistic epiphysis. And the fourth and the last type of epiphysis, if I talk about, it is known as the aberrant epiphysis. Okay, it is known as aberrant epiphysis. What do I mean by aberrant? Aberrant का मतलब होता है abnormal in literal terms. So this is not always present. याद रखना, this is not always present. Mandatory नहीं कि हमेशा present होना ही चाहिए. ठीक है? So this is the head of the first metacarpal. So the first metacarpal which lies beneath the thumb, इसका जो head बनता है, this head of the first metacarpal is an example of which type of epiphysis? Aberrant epiphysis. No issues with this? Understood all types of epiphysis? Chalo. Now let's talk about the question. Following examples of epiphysis are correctly matched except which among them is incorrectly matched, that you need to find. Option A says pressure epiphysis, head of femur. True. Traction epiphysis, tubercles of the humerus. True. Atavistic epiphysis, coracoid process of scapula. True. What is an exception? Aberrant epiphysis. No. Trochanters of femur are which type of epiphysis? They are traction epiphysis because they are created due to pull of the muscles. No issues with this, anybody? कौन सी muscles attached होती है? Greater trochanter पे शाबाश, gluteus minimus and gluteus medius, gluteus minimus and gluteus medius, please remember. And lesser trochanter पे और बोलो, कॉन्फिडेंस आने दो ना. Iliopsoas muscle, main muscle inserted is the iliopsoas. Yes, there would be some fibers of the gluteus maximus also, but the main muscle inserted is the iliopsoas muscle, which is a कहाँ होती है iliopsoas? कहाँ होती है iliopsoas बच्चों? Iliopsoas is made up of two muscles together, iliacus and the psoas, major or minor? Psoas major. Iliacus plus psoas major together is called as the iliopsoas muscle. It combines together and inserts as a common tendon on the lesser trochanter of the femur. Please remember this. No issues with this, anybody? It is a posterior abdominal wall muscle. Psoas major, psoas minor, iliacus, all of these are posterior abdominal wall muscles. No issues with this, anybody? That's the important funda over here. Okay, if I talk about the tubercles of the humerus, tubercles of humerus, greater tubercle पे क्या इंसर्ट होता है? Greater tubercle of humerus has insertion for which muscles? Rotator cuff muscle सुना है? शाबाश. Sits they are known as. Out of them only the sit muscles. Sit muscles को कैसे लिखते हो हमेशा? ऐसे. So that is supra spinatus, I for infra spinatus, I for teres minor. बच्चों इसीलिए ऐसे लिखा करो. T should always be small while writing a rotator cuff muscles. And जो बची हुई क्या होती है? S. That is subscapularis. So the fourth muscle of the rotator cuff, subscapularis, that gets inserted on the lesser tubercle of the humerus. No issues with this, anybody? ये देखो, ये muscles इतनी important क्यों है? Because they are responsible for the movement of the shoulder joint and they have the clinical application in orthopedics itself. ठीक है? When this rotator cuff muscles, it is responsible for the movements of shoulder joint. क्या क्या movements होते हैं shoulder joint में? Adduction हो सकता है, abduction हो सकता है, flexion हो सकता है, extension हो सकता है, circumduction हो सकता है. ठीक है? Right? So usually these are responsible for most of the movements over here. Deltoid is the chief muscle mainly, but this is responsible for the majority of the movements as well. So in case these get inflamed, तो क्या हो जाएगा? If the rotator cuff muscle get inflamed, clinical applications, anatomy से direct one line, मतलब ऐसे questions नहीं आ सकते अब कि हाँ हाँ ये बताओ क्या होता है, ये marking क्या है. So they will always ask you, rotator cuff muscles अगर inflame हो जाती है, क्या हो जाएगा? Due to inflammation चिपक जाएंगे एक दूसरे से. That is called as adhesive tendinitis. टेंडनाइटिस क्यों? क्योंकि ईच मसल इंसर्ट्स विद द टेंडन, तो उसके टेंडन्स का क्या हो गया? इन्फ्लामेशन, एंड वो क्या हो गया? चिपक गए उसकी वजह से. सो एडहेसिव टेंडनाइटिस ऑफ द रोटेटर कफ मसल, इट इज आल्सो नोन एज the patient will he be able to perform any movement in the shoulder joint? No, every movement of the shoulder joint will be restricted or painful it would be. ठीक है? क्या हो जाएगा? ग्लोबल रेस्ट्रिक्शन हो जाएगा. ग्लोबल मतलब in all directions there will be no movement of the shoulder joint or very painful movement of the shoulder joint due to the inflammation over here. So इसको क्या बोलते हो? जब हाथ नहीं हिला सकते हो, then you ask the patient to do these exercises. ऑर्थो में it is known as the frozen shoulder. Patient is not even able to perform a single movement, therefore it looks like as if the shoulder is frozen. Okay, that is called as the frozen shoulder. Adhesive tendinitis of the rotator cuff muscles, where there is global restriction in the movements of all shoulder joint, like there is global restriction in all the movements of the shoulder joint. कोई दिक्कत नहीं है इसमें? I hope this is clear to everyone now. ठीक है, चलो. Moving further, question number 2, if I talk about. Here we have a 16-year-old girl who failed in her final examination. Disgusted with life, she cut across of the wrist at the flexor retinaculum. She was rushed to the hospital. The surgeon noticed that the cut was superficial. All of the following structures would have been damaged except. Shabash. So please remember, I hope all of you are quite aware of the anatomy of the wrist. If I talk about anatomy of the wrist, सबसे पहले, what are these over here? These are your, क्या होते हैं wrist में, कौन से bones होते हैं? Carpal bones. How many carpal bones do we have? 8 carpal bones. Lateral to medial बताओ जरा. अब bone के नाम भी बता दो. She looks too pretty, try to catch her. She for scaphoid, looks for lunate, 2 for triquetral, very good, and pretty for pisiform. Try to. T for trapezium, T for trapezoid. ठीक है? Then she looks too pretty, try to catch her. Catch for capitate and her for hamate. No issues with this, anybody? That's important. Now over here, please remember, extending from the scaphoid and the trapezium, extending from the scaphoid and the trapezium to the pisiform and the hamate. To the pisiform and the hamate, we actually have a sheath. That sheath is known as the flexor retinaculum. This sheath is what is called as the flexor retinaculum. ठीक है, it is only attached at the borders, बीच में जुड़ी हुई नहीं होती है. So it is only attached at the border, something like this. See, it is attached over here, it is attached over here. तो बीच में क्या बन जाएगी? Space बन जाएगी. There's a space which is formed beneath the flexor retinaculum, and this space is what is called as, looks like a tunnel. It is known as the carpal tunnel. ठीक है, this space is what is known as the carpal tunnel. तो carpal tunnel का floor किससे form होता है? The floor of the carpal tunnel is formed with the help of the bones. Which carpal bones mainly? The scaphoid, capitate, hamate, even the pisiform participates, and आगे जाके again the trapezium, trapezoid, capitate, and hamate. So please remember, carpal tunnel is a larger tunnel. Therefore, all of the 8 carpal bones will form its base or the floor. ठीक है, तो floor is formed by the carpal bones, whereas roof is formed by what is this? Flexor retinaculum. So roof of the carpal tunnel is formed by the flexor retinaculum itself. No issues with this. So roof by flexor retinaculum, base by the carpal bones. और बीच में जो जगह बचती है, that is what is your carpal tunnel over here. Now there are important structures which will pass inside this carpal tunnel, and the most important is the nerve which passes inside the carpal tunnel. That is called as your median nerve. The most important structure which passes inside the carpal tunnel is called as the median nerve. For example, if there is fracture of the scaphoid bone, dislocation of the lunate bone, okay, so what will happen? There can be distortion in the carpal tunnel, and that can compress a particular nerve. So that is what is called as carpal tunnel syndrome. CTS is nothing but carpal tunnel syndrome. It is due to dislocation or fracture of any of the carpal bones, okay, or due to edema, which will compress the nerve inside the carpal tunnel, and that nerve which is compressed inside the carpal tunnel is the median nerve. Straight away question, carpal tunnel syndrome, which nerve is involved? Answer is median nerve. Okay, apart from this, there are 8 tendons which pass. In total, there are 10. But if I talk about the 8 main tendons which pass, so I hope all of you are quite aware. This compartment of the forearm contains which type of muscles? Flexor or extensor? Very good. So this anterior compartment of the forearm is also known as the flexor compartment of the forearm. It contains all the flexor muscles. See, these muscles contract when we need to do flexion. When we need to do flexion of the wrist, these muscles will contract. No issues with this, anybody? So these flexor compartment muscles would be what? Flexors होंगे ना सब, except the pronator teres and the pronator quadratus. बाकी सब के सब क्या होंगे? Flexors ही होंगे. What are the 4 flexor muscles in the anterior compartment of the forearm? The flexor digitorum superficialis, flexor digitorum profundus, flexor carpi ulnaris, and flexor carpi radialis. I hope all of you are quite aware. Flexor carpi ulnaris. Ulna lies on which side? Medial or lateral? Medial. So flexor carpi ulnaris is a medial muscle. Radius usually lies on which side? Lateral. So flexor carpi radialis is a lateral muscle. And then we have flexor digitorum superficialis and the flexor digitorum profundus in the middle. Superficialis मतलब ऊपर, profundus मतलब deep. ठीक है? So this flexor digitorum superficialis is innervated by the median nerve. Ulnaris will be innervated by the name itself, ulnar nerve. Radialis will be innervated as it lies laterally, so it should be innervated by the शाबाश, it is the median nerve. ठीक है, it is the median nerve. Because anterior compartment of forearm will only have two muscles. Medially it is ulnar, laterally it is median. Radius हमेशा posterior compartment को supply करती है. It never comes in the anterior compartment. याद रख लो, it never supplies the anterior compartment. ठीक है, no issues with this anybody? Whereas flexor digitorum profundus is innervated by both the nerves. Medial half will be innervated by the ulnar nerve and the lateral half by the median nerve. Now all these सबके टेंडन्स जो होते हैं ना, प्लीज रिमेंबर, इसका एक टेंडन होगा, इसका एक टेंडन होगा, बट इनके कितने टेंडन्स होंगे? These will have 4 tendons each. So they come till the wrist and then they divide into 4 tendons each. ठीक है, flexor digitorum superficialis के 4 tendons and flexor digitorum profundus के 4 tendons. Flexor digitorum superficialis के 4 tendons कहाँ जाएंगे अटैच होने के लिए? मिडल फैलैंक्स पे जाके अटैच होंगे. whereas flexor digitorum profundus के ये थोड़ा लंबा चलेंगे और ये कहाँ जाएंगे अटैच होने? डिस्टल phalanx पे जाएंगे. आई होप ऑल ऑफ यू आर क्वाइट अवेयर ऑफ द phalanges. ये जो डिजिट बनाते हैं बोन्स, इनको phalanges बोला जाता है. proximal, middle and distal phalanx. Thumb only contains proximal and distal phalanx, no middle phalanx as such. No issues with this anybody? So that's the important funda. So all these tendons which are there, all of these tendons will pass via which tunnel? All of these tendons will pass via the carpal tunnel itself. कितने tendons pass होते हैं? 10 tendons pass होते हैं. Mainly 8 tendons, these two. अगर exception mark करना है, then what can you be your exception? Flexor carpi ulnaris. The reason is वो भी carpal tunnel से pass होता है, but अलग से pass होता है. ठीक है, इसीलिए अगर सब ऑप्शंस में एक एक्सेप्शन इसी में से मार्क करना है तो आंसर कैन बी एफसी और एफसीयू. नो इश्यूज विद दिस एनीबॉडी? प्लीज रिमेंबर दिस. ठीक है, नाउ ये तो तुमने देख लिया कि कार्पल टनल इज इट डीप और इज इट सुपरफिशियल? कार्पल टनल बोन के जस्ट ऊपर है, सो इट इज डीपर. इट इज डीपर. नाउ इफ आई टॉक अबाउट द फ्लेक्सर रेटिनाकुलम, इस फ्लेक्सर रेटिनाकुलम के बाद भी क्या होगा? सो दिस इज योर कार्पल बोन, this is your flexor retinaculum, this is your carpal tunnel. Above the flexor retinaculum there is a ligament, and what is that ligament called as? Anybody? That ligament is known as the pisohamate ligament. Above the flexor retinaculum there is a pisohamate ligament which will extend from the, ये दूसरे कलर से निकाल रहा हूं, from the pisiform bone to the hamate bone, to the pisiform bone to the hamate bone. And via this ligament again क्या बन रही है? केनाल बन रही है ना इसमें भी. So this canal which is formed, base क्या होगा इसका? These are carpals बच्चों. This is flexor retinaculum. This is the pisohamate ligament. So base of the canal which is formed superficially, इसका base क्या है? flexor retinaculum. And roof क्या है? pisohamate ligament है. roof क्या है? pisohamate ligament. ये जो canal बन चुकी है, इस canal को क्या बोला जाता है? Anybody? This canal is what is called as the Guyon's canal, right? This is known as the Guyon's canal. It can also be referred to as the ulnar canal. Guyon's canal also be referred to as the ulnar canal. The reason is what passes within the Guyon's canal? It is the ulnar nerve and the ulnar vessels. That is your ulnar artery as well as your ulnar vein. Okay? So the ulnar nerve and the ulnar vessels pass via this Guyon's canal, the superficial canal, and therefore क्या हो जाएगा? It will be injured in any superficial injury to the wrist. Whereas carpal tunnel के structures will only be injured if there is a deep injury to the wrist. No issues with this anybody? What passes via the carpal tunnel? As I've told you, which nerve? It is the median nerve. And tendons तो already मैंने लिखवा दिया, so I'm not writing it. ठीक है? So now let's see. Option A says all of the following structures would have been damaged except, so all the structures which are superficial will be damaged. Okay, why? Because they have said what? That the cut was superficial. So all the superficial structures will be damaged. Option A says ulnar nerve. Ulnar nerve is superficial or deep? It is superficial. It is in the Guyon's canal itself. Therefore, it should be injured. Median nerve is superficial or deep? It is deep in the carpal tunnel. Therefore, it should not be or it cannot be injured. Palmar cutaneous branch of the median nerve. Now, the whole median nerve goes inside the carpal tunnel, but one of the branch which has to supply, cutaneous का मतलब क्या होता है? Skin. So one of the branch which need to supply the skin over here It will come out of the carpal tunnel. तो ये देख लो, एक मीडियन नर्व की ब्रांच जो है ऊपर से जाती है, that is called as the palmar cutaneous branch, the one which will supply the skin of the palmar aspect of the hand. ठीक है, तो इसको, इस स्किन को जो सप्लाई करेगी, that is what is called as the palmar cutaneous branch of the median nerve. तो superficial जा रही है, deep जा रही है, वो superficially जा रही है, because it needs to innervate the skin. Therefore, it will also be damaged. Whereas last option is superficial branch of radial artery. नाम में ही superficial है उसके. Superficial branch of the radial artery. Radial artery passes via. आगे देखेंगे उसको क्या बोलते हैं, इसको क्या बोलते हैं, इसको शाबाश, anatomical nerve box. And what is the content of the anatomical nerve box? It is the radial artery. Okay, so the superficial branch of radial artery passes over here in the medial aspect of the palm. Okay, so that will also be damaged. So what is not at all damaged is the median nerve, because it lies inside the carpal tunnel, protected by the flexor retinaculum. So therefore it will not be damaged. No issues with this, anybody? So it is just the carpal tunnel Guyon's canal syndrome wala question, but just modified in a different version. Okay, so that's the important thing. So Guyon's canal syndrome agar wo bolte hai, so what is compressed which nerve? Ulnar nerve or the ulnar vessels. Agar wo bolte carpal tunnel syndrome, which nerve is compressed? It is the median nerve. Question number 3 now. The boundary of the triangle of auscultation is not formed by. I hope all of you are quite aware. Triangle of auscultation is on the anterior aspect of the thorax or the posterior aspect of the thorax? It is on the posterior aspect of the thorax. This is what is called as the triangle of auscultation. इसीलिए तुमने देखा होगा, we try to auscultate from the back side, right? You might have seen a lot of respiratory medicine specialists, they do auscultate from the back side only. ठीक है, and they auscultate actually this triangle of auscultation. Why it is called as triangle of auscultation? Because यहाँ पे कोई muscle as such present नहीं होती है. Therefore, the lung sounds will be clearly heard if you keep the diaphragm of the stethoscope right on the triangle of auscultation. If I talk about the boundaries of the triangles of auscultation, what is this muscle over here? It is the trapezius muscle. Okay, it forms the upper back of the patient. Okay, so that forms which boundary? That forms the medial boundary, right? Just a minute, I need to change the pen. That forms the medial boundary of that triangle of auscultation. Next, what is this muscle over here, which forms the lower back? It is the latissimus dorsi. And latissimus dorsi forms which boundary? It forms the inferior boundary or the floor, you can say. It forms the inferior boundary or the floor of the triangle of auscultation. Whereas this, the third or the lateral boundary which is there, this lateral boundary which is there, please remember, lateral border of the triangle of auscultation is formed by the scapula. Which border of scapula? Scapula ऐसा होता है ना यहाँ पे. It is the medial border of the scapula. Please remember, it is the medial border of scapula which forms the lateral border of the triangle of auscultation. कोई दिक्कत नहीं है इसमें. This is what is your triangle of auscultation. So what is not your answer? Scapula forms the lateral border, trapezius forms medial border, and latissimus dorsi forms the inferior border. Serratus anterior does not form any border of the triangle of auscultation. कोई दिक्कत नहीं है यहाँ तक. Then there are two important triangles again over here. There are two important triangular spaces and one quadrangular space again in the posterior aspect of the back. What are these triangular spaces? So first one you can see, this is called as the triangular interval over here. And important is what passes via the triangular interval. It is formed by which, what are the boundaries? It is formed by the humerus, then it is formed by the teres. Green muscle कौन सी है? Teres major. And then it is formed by the long head of triceps brachii. So this triangle over here, what passes via this triangle? It is the radial nerve and the profunda brachii artery. Profunda का मतलब क्या बोला था मैंने? Deep. Brachii का मतलब arm. ठीक है? So it is the profunda brachii artery and the radial nerve which passes via this triangular interval. Next, if I talk about this one, this over here is again a triangular space. And what passes via the triangular space? It is the circumflex scapular artery. Circumflex ka matlab which takes a turn around the bone. That is called as a circumflex artery. So it is a circumflex scapular artery. Superior border is formed by the teres minor. Inferior border by the teres major. And lateral border by the long head of triceps brachii. Okay. And last is this quadrangular place, which is highlighted in blue color. Superior boundary is formed by the teres minor muscle. Then lateral boundary is formed by the surgical neck of the humerus. Medial boundary is formed by the long head of triceps brachii, and inferior boundary by the teres major muscle. This quadrangular space is the site for passage of the axillary nerve. What is in close relation to the surgical neck of the humerus? Which nerve? It is definitely your axillary nerve. I hope all of you are quite aware that this is the surgical neck of the humerus, and axillary nerve takes a turn around the surgical neck of the humerus. Therefore, if they say that what is the most common site for fracture of humerus? It is the surgical neck of the humerus. समझ गए किसीलिए important है इतनी है because if they say the patient has sustained a humerus fracture but they have not mentioned the location, what is the most common site? It is the surgical neck of the humerus, and we know what lies in close relation to the surgical neck of the humerus is the axillary nerve. तो किसके डैमेज के चांसेस होंगे? Axillary nerve के डैमेज के चांसेस ज्यादा होंगे. ठीक है. And the second thing which goes in this quadrangular space is known as the posterior circumflex humeral artery. There are two arteries which goes around the सर्जिकल नेक ऑफ द ह्यूमरस. जो आगे से जाएगी उसको बोला जाएगा एंटीरियर सर्कमफ्लेक्स ह्यूमरल आर्टरी. जो पीछे से जाएगी उसको बोला जाएगा पोस्टीरियर सर्कमफ्लेक्स ह्यूमरल आर्टरी, एंड दे फॉर्म अ नेटवर्क ओवर देयर. नो इश्यूज विद दिस एनीबॉडी? So that's the important funda. So if there is surgical neck of humerus fracture, not only the axillary nerve will be damaged, but also the circumflex humeral arteries will be damaged. Anterior, posterior, circumflex humeral arteries will also be damaged. Axillary nerve की root value क्या है? C5. अब मैं थोड़ा ऊपर नीचे चलूंगा because this is not in